Mental health tends to frequently take a back seat to physical health. Why is this? Are physical health and mental health independent of each other? Better yet, what is mental health anyways? According to the CDC, mental health includes our emotional well-being, which are our feelings, psychological well-being, which are our thoughts, and social well-being, which are our interactions with others. Mental health is an important part of our lives and influences certain aspects of who we are as human beings. Our mental health influences the choices we make, how we handle various situations, the actions we take, our thoughts, how we relate and interact with other people, and our mood. For example, if a person is feeling sad or depressed, they may be less likely to interact with friends, family, or humans in general. They may also think negative thoughts about themselves, which may lead to increased symptoms of depression and further isolation. Mental health is important at every stage of our lives, from childhood, adolescence, and throughout adulthood. Mental disorders can contribute to a variety of problems, which may include disability, pain, or death. In general, mental illness is a term that refers to a diagnosable mental disorder or condition. Two terms used to describe mental illness are any mental illness and serious mental illness. Any mental illness is defined as a mental, behavioral, or emotional disorder. In other words, disorders of the mind or thoughts, the way we act or behave, and how we feel or our emotions. As previously mentioned, a mental illness can vary in severity based on how much it interferes with the person's ability to function in daily life. There may be no impairment, mild impairment, moderate impairment, or severe impairment in the person's ability to accomplish major life activities. An individual who is experiencing severe impairment would be classified as having a serious mental illness. The person may not be able to provide for themselves or their safety. They may struggle with performing routine hygiene such as bathing or brushing their teeth. Mental illnesses may cause impairment in the person's social life, education, marital life, financial well-being, or even legal problems. For instance, a person with a severe gambling addiction may have difficulties maintaining their finances. Their house may be foreclosed, lights frequently disconnected. They may miss classes or perform poorly in college due to gambling, on the verge of divorce, and have poor relationships with their friends and family. On the other hand, they may have some mild symptoms of depression and be able to cope and not experience any impairment in their lives. There are several contributing factors that may influence the person's development of a mental disorder. Factors such as trauma, abuse, sexual assault, witnessing violence, early adverse childhood experiences, maternal illnesses during pregnancy, environmental factors, and social factors may all contribute. Chronic medical conditions or terminal illnesses also contribute to the development of a mental illness. It is worth noting that mental illnesses are listed among the most common causes of disability. If you are experiencing symptoms such as feeling down, angry, difficulty sleeping, or tearfulness, but not severe enough to be diagnosed as a mental illness, well, in this case you may be experiencing poor mental health. A person can experience periods of poor mental health and not meet the criteria to be diagnosed with a mental illness. And most certainly, a person diagnosed with a mental illness can experience periods of good mental well-being. So, what is the difference between poor mental health and mental illness? Although these two terms are often used interchangeably, poor mental health and mental illness are not the same. As previously discussed, mental illness refers to conditions that meet the criteria for diagnosis, and poor mental health does not. A person with poor mental health may experience difficulty coping with stressful situations, sadness, worrying, irritability, or experience a range of other emotions, thoughts, and actions that aren't exactly ideal. These individuals will either recover from the symptoms or progress to a mental illness. Therefore, it is ideal to seek help if you notice worsening or persistent symptoms. How common is mental illness? According to the CDC, in the year 2020, there was an estimate 52.9 million adults in the United States with a mental illness. This number represents 21% of the adult population in this country. The prevalence was higher among females, who accounted for 25.8%, than males, who represented 15.8%. In addition, statistics show that 1 in 25 Americans has a serious mental illness, such as schizophrenia, bipolar disorder, or major depression. It is also estimated that more than 50% of Americans will be diagnosed with a mental illness at some point in their lifetime. In addition, 1 in 5 children, either currently or at some point during their lives, have had a seriously debilitating mental illness. How does my mental health influence my physical health? As previously mentioned, mental health and physical health are closely intertwined and can influence each other. Mental illnesses such as depression may increase an individual's risk of developing high blood pressure, diabetes, and having a heart attack or stroke. In addition, mental illnesses may have a negative impact on the person's ability to engage in a healthy lifestyle or maintain good physical health. Likewise, a person who has poor physical health, such as cancer, HIV, AIDS, lupus, or any other chronic condition may experience severe impairment of their mental health. Chronic diseases may lead to depression, which can impact the person's response to and willingness to undergo treatment. I don't have any of those symptoms. Is it possible for me to develop a mental illness in the future? Simply put, yes, your mental health can change. Stressful situations that affect our ability to cope, poor financial status, stressful employment, sleep deprivation, working long hours, being a caregiver for others, declining physical health, marital or relationship problems, grief, and a host of other factors may contribute to a change in mental health. Tell us in the comments about your thoughts regarding mental health. Were you aware that mental health and physical health had such a major influence on each other? I would like to thank you for taking the time to view this video. I hope you found it helpful and educational. Please like, subscribe, and push the notification bell so that you do not miss any new content.